Today's topic is diabetes care, how to check your blood level and give insulin. There is a new treatment for why a new treatment for diabetes is important? Because the complications from uncontrolled diabetes are devastating. What is the third leading cause of death in the United States after heart disease and cancer? It's diabetes. Diabetes is the leading cause of new cases of blindness, accounts for more than 60% of non-traumatic lower limb amputations. 73% of people with diabetes have a blood pressure reading more than 130/80 or use medication to control their hypertension. I was a steroid-induced diabetic just a couple of years ago, got really sick, ended up in the hospital for quite a few weeks before they could figure out what was wrong with me. First, I'm going to be telling you why diabetes management is important. Then I will show you all the supplies that you need to care for your diabetes. And finally, I'll show you how to actually check your blood level and give yourself insulin. The mainstay of diabetes care is medical management. Good control of blood glucose, blood pressure, lipids, and good eating habits leads to marked reduction of associated medical complications. However, 1 in 5 patients have poor control of their diabetes, which leads to an increase in mortality and morbidity. Now, the supplies needed to care for your diabetes are your syringe, the alcohol swab, a blood glucose monitor, your insulin, and your SoftClicks pen, and of course some some cotton balls. First, what you will do is you'll actually take this SoftClicks pen, take the top off, take one of these little lancets, twist this off, and you insert it here. Then you put this back on, and then once it locks in place, you push it down and prick your finger. Once you do that, you take this little glucose monitor, and there's a little strip sticking out here. You put it there so you can measure the blood. It'll give you a readout of what your number is, and according to that number, say it's like between 100 and 110, then what you'll do is you'll turn around and, for one, use your alcohol swab, find a place on your stomach, legs, or your arms. Use the swab, get that spot, clean it off real good. Then you will turn around and dry it off. Then you will turn around and take, for that one reading I told you, 100 to 110 will be 2 units. Then you will take a different swab the top of the insulin bottle, insert this syringe in, and take out 2 units, which is not very much really. You want to make sure there's no air in there. And once that's ready, then you go back to the spot that you picked out, inject it into your arm, stomach, or leg, and put your insulin in. Hold it for a few seconds before you take it out, and then once you're done, just wipe it down again with an alcohol swab, and then you're ready to go. You're done. I actually have to do this 4 times a day. This is actually the night insulin that we use just for right before bedtime, and this is the regular Novolin R insulin I use during the day. In summary, this is why diabetes is the 3rd leading cause of death in the United States, and a new treatment or cure needs to be found for those living with the disease. It's important to learn how to manage your diabetes with medicine or insulin, good eating habits, get the supplies needed to keep your diabetes in control, and lastly, be sure to follow your regimen daily on blood testing and taking insulin injections when needed. According to MedicineNet.com, diabetes affects approximately 17 million people, about 8% of the population in the United States. In addition, an estimated additional 12 million people in the United States have diabetes but don't even know it. Diabetes is a chronic medical condition meaning that although it can be controlled, it lasts a lifetime. Thank you.